tonight. You no longer have to worry about being fined if you're caught not wearing a mask in public in at least 5 states in the country. Given a substantial decline in the number of COVID cases that we're reporting, given the fact that a majority of our population is vaccinated, the Delhi government on Friday announced that they're changing the policies, the rules are being changed. You no longer have to worry anymore about being caught, pulled over by a traffic cop and paid a fine because you weren't wearing a mask in your car. They've changed the rules, and Delhi is not alone. Maharashtra, Telangana, West Bengal have all followed suit. So does this mean the worst is over? Does this mean it's now safe to go commando, that you can unmask? Should you no longer be wearing your mask? Well, to help us take that important, crucial health decision, I have Dr. Muzaffar Lakrawala. He's the advisor for the BMC for COVID Jumbo Facilities, the director of surgery at the Reliance Foundation Hospital in Mumbai, an honorary surgeon to the vice president. We have Dr. Sunila Garg, a member of the Lancet Commission of the COVID India Task Force. She is at the Maulana Azad Medical College, an advisor to the ICMR. Jasmine Shah of the Aam Aadmi Party, the spokesperson, the vice chairman of Dialogue and Development Commission at the Delhi government. Dr. Suresh Kumar joining us here, MD of the LNJP Hospital and a member of the Delhi COVID Task Force. And we're going to try and go across to all of these doctors to try and understand what we should be doing with the information that we have at our fingertips right now. Dr. Muzaffar Lakrawala, to you first. It was just starting to seem like things are finally going back to normal, or life as we knew it. Our schools are finally open. International flights are no longer grounded. And so it seems logical that when you have here that at least 5 states are announcing that we no longer need masks. Is that true? What do you think?
We are not over with COVID yet. COVID is still hanging around. The question is that by removing the mask mandate, what the government has done is has shifted the focus and responsibility from their responsibility to every individual's own responsibility. I think it is incumbent on all of us, even after we are double vaccinated, to make sure that with the newer variants coming around, that we should continue to mask in public places. However, the need for masking probably at home has probably come down.
But even as governments in 5 major states have in their wisdom said that we no longer need masks, we have at the same point of time the WHO coming out with this new ominous sounding XE variant. So what does this XE actually mean for a country like India, given our numbers, given our vaccination numbers?
The COVID virus is an mRNA vaccine, is a RNA virus, and all RNA viruses are known to mutate over a period of time. Yeah. The more and more we throw in vaccines, the more and more the virus will try to fight back with mutations. However, it is a known thing in virus history that the more mutations that happen on the spike protein, the earlier it is that the virus is reaching towards its end. So let's hope that is true. However, any mutation which is a mutation of concern should be something we should be concerned about. We should not read too much into it if there's just a virus mutation which has come up. So I would look at it as a good sign that though it is more transmissible than the Omicron, that just means that we'll have many, many more mutations on spike protein, and probably we are reaching towards the end of the pandemic.
So, Dr. Lakrawala, one more question to you. As you've been saying, and other health experts have been saying, that COVID is here to stay. We have to get used to it. There are going to be some variants or the other. In that case, I want to ask you, what about boosters? Because we haven't been hearing, there don't seem to be any boosters in sight for the adult population in India. Dr. Lakrawala.
We've got a population of 1.3 billion people. So the challenges with the government remain as to how many people are they going to give boosters on. Because remember one thing, that they also need to vaccinate the younger under 18 population and the under 15 population, which has not yet been done. So I think the challenges in India are different from those challenges faced across the world. Boosters are advised in some of the parts of the world, but even there is a reluctance. The moment the numbers go down, people are reluctant to take boosters. So I think that's something that we'll have to take with a pinch of salt.
All right, so Maharashtra, where Dr. Lakdawala is from, was one of the first states to take this decision, and then Delhi followed suit. So let's bring in now Jasmine Shah of the Aam Aadmi Party. Jasmine, the Delhi Development Management Authority said that face masks are no longer mandatory. However, the government says that wearing a mask is still advised. So what is it? Because this seems contradictory. What is AAP's stand on the issue of unmasking right now?
Absolutely. We welcome the decision of the DDMA, and in the DDMA meeting, the AAP government very much supported that it is time that we should be unmasking. However, this is a recommendation for adults because we know that vaccination rates in Delhi are probably the highest in the country. We've had 100% of adults have been vaccinated with one dose and 90% with the second dose. And that's the reason even seroprevalence, all the data, the entire scientific advice that we have received, that's the basis of us recommending that it's time that we start unmasking in Delhi. However, I would say, sorry, it's not time to unmask. It's time to stop fining people for masks. We are still saying that as a precaution, people should, especially if they are in crowded settings, if they are indoor settings, we know now what is the nature of the beast. So for those purposes, our advice is still that people should mask, but it's too harsh now to start fining people for not masking.
But Jasmine Shah, just a day after, actually, the Delhi government made this new announcement. The WHO announced that new variant, the XE, that I'm sure you know about. Isn't that worrying? Was this?
That's right, and I think that's it's always a concern when a new variant of COVID has been found, and on that front, we will be very closely following the advice of our public health experts, the government of India, ICMR, and we'll have to see at what time do we need to start worrying as the people of the country or people of Delhi, because we do know that Delhi and Bombay are probably the first points whenever a new variant has arrived in India because of the international traffic that these two cities see, that we need to be very watchful. So to that front, the government is very alert, and we will go as per the scientific advice at all points in time.
Well, but the science across the world over says that we should be getting a booster shot, given that these variants keep emerging and this virus keeps mutating.
Sarah, you know that this is a government of India decision that holds for the entire country. Our government has always followed the advice of the scientific community, and as far as that goes, it is unambiguous. It is time for booster doses to be administered to all the adults. We do know that our frontline workers and the senior citizens have already been given the booster dose, and there's no reason. I mean, we are seeing countries around the world who are going on for a second booster dose because the life of a booster dose is said to be around 6 months. So we very strongly support and urge the government of India that let's follow what the scientific community is recommending and go in for booster doses, especially large cities which typically see a lot of international traffic.
All right, so we have Jasmine Shah saying that we should go in for a booster dose, especially for those who are more vulnerable. Dr. Suresh Kumar joining us now. Before I want to ask you about who exactly are more vulnerable and who exactly need these both booster shots and masks. Look, you know, the public is tired. They're kind of weary of this. It's been 2 years. It's also getting hot where they're anticipating a heat wave that's going to begin in 2 days. In the middle of all of this, it would be very hard for anyone to enforce this mask. Was this just the easy way out? And as a doctor, how do you feel?
Welcome the DDMA recent guideline that once we have the number of new cases are very less. We have seen that positivity in most of the state is between 0.5 to 0.7%, and new cases are negligible. We have seen that for last 2 years we have the very robust vaccination program in country, and majority of the age group about 12 is already covered by the vaccination, and we have 100% vaccination in Delhi and most of the states, and second dose is also more than 85%. We have seen that now schools are opening, colleges are opening, and with the very good vaccination program, now we must have a relaxation in the mask policy, and many countries have done this already. The UK, the Canada and the USA even, there is a relaxation. When we have the indoor activity and clustering, then only we require mask, and the high risk group we require mask. But Once
Is there anyone who
the
you
high risk group is one where
would
you have
advise
the
that should always
poor
make sure you wear a
immunity,
mask?
you have not
Despite what the
fully
government
vaccinated,
says.
not have received 2 doses of vaccine. So this group definitely need masking, and we have seen that if you are in a restaurant or in a crowded place, you need to wear mask.
What happened to that logic? We were saying that, look, if everybody wears a mask, not just are you protecting yourself, you're also protecting others who are at high risk, who are more vulnerable.
Definitely, if you have the vaccination, it depends on the if you have the more positivity, more infected people, more COVID persons in the locality, then you require the mask. Otherwise, if it's no longer a public health problem, positivity rate is less than 0.5%, then you must enforcement and the fine should go away, definitely.
Okay, let's bring in another aspect here. We have Simran Khara joining us. She's the mother of a 6-year-old. She's a startup founder, alumni of the LSE and the ISB. We have Tanya Agarwal also joining us. She's a lawyer, also the mother of a 6-year-old. Both Simran and Tanya have petitioned the Delhi government to stop the mandatory masking of kids in school. So what's the problem here, Tanya?
The problem here is that mask mandates have been imposed in schools without regard to age group, without regard to local community transmission levels of COVID, and without regard to what kind of environment the kids are in. Are they indoors, outdoors? How good or bad is the ventilation? Now, this goes completely against global guidance. And just as an example, the WHO and the UNICEF say that under 5s don't need to be masked at all. 5 to 11 years old need to be masked in areas where COVID is spreading and in certain types of indoor settings. But this blanket mask mandate just disregards all of that. We have 2 years of data to show us that children are actually at very low risk of severe or fatal COVID as compared to adults. But why do we not put them first? You know, schools were opened right at the end. I think least priority, exactly. So I just don't see that compelling evidence, the compelling reason to mask kids with this blanket mandate when the penalty for adults has been removed. And what is the logic of removing the penalty? Like, is this a public health measure or is it a budgetary measure that we no longer need those fines? So let's remove the fine. But if it is a public health decision that we're removing the fine because we don't think the mask is needed anymore, then please say that and adapt that measure to age groups. If there are vulnerable groups, advise them to wear masks. But I don't see the logic of masking only kids because, you know, again, it's the same discussion we had at the time of school closures, that adults can also bring infection home. So what are we achieving?
So Simran, as far as we know, things don't change for school kids tomorrow. So when they go to school, they still have to wear their masks?
Yes, we've not received any sort of communication saying that they can be without masks. So the assumption is that tomorrow my 6-year-old puts on her mask at 7:35 and when she comes home at 3:35 after 8 hours, that's when she takes her mask off, barring the 15 odd minutes that she will use for her lunch break or for her water break.
And this concerns you?
This concerns me a great deal, right? Like any health intervention, and I suppose, you know, doctor here would agree, right, is that any intervention has certain benefits and certain costs. I think it's very easy to never talk about the costs of masking. There are demonstrable costs of masking. There's a CO2 buildup in the mask. There's communication issues that happen. In our sort of heat and humidity levels, there's possibility of bacterial and skin infections happening. Imagine you're going to be masking in 40 degrees in that level of humidity, and you're going to do it day after day. But you know what? That's not what alone bothers me as a mother. What bothers me is that we constantly put the kids last. Yeah. Even before the mask mandates were lifted, adults were roaming around maskless. Just have a look at the election rally pictures. Just go to your cinema hall, you'll see them there. Go to public spaces, gardens. Nobody was masking, right? Nobody was masking. The adults were not masking. The children are powerless. Yes. It's very easy for a class teacher to look at my child sternly, and that's it. She's going to be masked for 8 hours. It is inhuman at this point in time. Also, Sarah, if I'd add, it's very illogical as well, because schools are not a regular sort of public space or a private space. Here's a space where you have a classroom with 30 students. They are staying together for 8 hours, doing all kinds of activities together. They're going to eat together. They're going to put their masks down. It's shared washrooms. So the real interventions we should be looking of have to be outside of mask. Perhaps ventilation is something a lot of experts spoke about. Yet there's no optics to ventilation, right? Like,
So this is like a placebo effect.
it's absolutely a placebo effect at this point in time. I would like to challenge a politician or a policymaker or a doctor to sit in 40 degrees heat and mask for 8 hours. If they can do it, I will do it. I'll make my child do it.
Well, okay, let me bring in Dr. Lakrawala in again here. Dr. Lakrawala, I don't know if you've heard them, but we have these two mums here. They're very concerned. They're speaking for other mums. They're raising some serious issues. They're concerned that perhaps we could actually be harming our kids in the name of actually trying to protect our kids. Nobody is required to wear a mask except for these little ones. What do you think?
See, being a surgeon, I've got a mask on right now. All I can say is that we protect ourselves from getting viruses. We protect our patients from getting germs from us. So masking should become a norm across the world, irrespective of whenever we do, because it'll only going to help you prevent respiratory illnesses.
No, but you're an adult. These are little kids. There are 3-year-olds going into nursery. The new year is starting tomorrow, and they're 3-year-olds, 3.5-year-olds going into nursery. Is your advice the same for little kids? We're talking about just for little kids.
No, not in the schools. Definitely not in the schools. Definitely not under the age of, let's say, 7 or 8, because it's not even possible for them to mask up properly. But yes, if these kids above the age of 5 were to go into public places, I think it would be incumbent that the parents teach them how to mask up properly.
Okay, so Dr. Lakrawala says kids above the age of 5, he advises in public places should be wearing a mask. Jasmine Shah, can I just ask you that as our mums here, Simran has pointed out, in Delhi and in other states, but in Delhi, let me speak for Delhi right now since that's where we are. Everything was open, from malls to bars to you name it, we could go everywhere, but the kids could not go to school. We could not send our kids to school. And now we have an ironic situation again where everyone's free from wearing masks except the little kids.
Sarah, I understand the concern for the parents. Let me first make it categorically clear that the AAP government had always supported the early opening of schools. We were the first government to say that we cannot keep kids away from schools. As far as masking is concerned, we must remember that the vaccination for the younger children is still not there in India. For 15 to 17-year-old, Delhi has the highest rate of vaccination, in fact, across the country, 70%. But for the younger children, we would rather want them to be studying physically in offline mode for as long without the fear of an outbreak. And until we have a vaccine that can be administered to all kids, our advice would be that masking is important. And let's also remember that schools are indoor settings. It's a crowded place. And if at all a new variant comes, it'll actually spread very rapidly in schools. So let's observe all the precaution until we have a vaccine that we can give to all of us.
Okay, I want to just bring in our audience who've been sitting here. Thank you. I think I have some college students. Apurva Gauri.
Yes.
You're a journalism student.
Yes.
And Surbhi Gupta. Okay, go ahead, Apurva. Your views on this, on masking firstly. Like we were just saying, we have a heat wave coming up. Lots of women complaining of, face issues. But of course, we wore masks because we thought it protected us. But now we're being told that we don't need masks.
So I absolutely agree with the opinions put forth about how masking for children makes absolutely no sense. Frankly, I think that there's much more to be done in terms of infrastructure, because without proper ventilation, without proper spaces for students to be sitting apart from each other, masks alone would not really make a lot of sense. Also, children indulge in playing and activities that need more breath. And with masks that can actually be very, very dangerous to their respiratory health as well. And of course, skin, heat, everything else remains a problem for sure.
But Surbhi, you're a college student. What is the policy in college? Were you guys having to wear masks before? Would you have to wear masks when you go to college?
Okay, so the policy in the college was the mask and the social distancing measures were made compulsory in college, but as we see the situation because of the infrastructure issues at a college, we cannot imagine 72 students sitting in a small classroom which can only accommodate 30 students in a place. So it's not possible. Although students were trying, but the measures could not be followed in a real world. So apart from what we see about the children, so it's not possible, I guess. But if we see from the government point of perspective, I would ask the government, what if the fourth wave come? Like we see how the China is reporting the number of cases are increasing. But what if the cases like in India also increases? What are the measures which the government is planning to bring afterwards? Like if we kind of face that kind of issue again. Yes.
But I'd like to speak with these two ladies behind you. If you can pass the mic on to them, because they're the only two who I see still wearing masks. Very impressive. I want to know why you're wearing a mask. Go ahead.
My opinion is it's completely our choice. My opinion is it's completely our choice. If we feel comfortable in wearing mask, we should go for it. And if we don't feel comfortable, then we should stop using mask.
Well, basically, it's been left to you now. Your health is in your own hands. Nobody's taking responsibility for it. What about you? You're wearing a mask. You're choosing to wear a mask. And I want to ask you, do you feel that as you go forward, now the peer pressure will be more on you? People will be like, yeah, why are you wearing a mask? Because, I mean, at least before, the government had said that you should wear a mask, right? So is that going to be, do you feel any peer pressure now? Do you think that'll be a problem?
I mean, I don't think it's a peer pressure, but I think it's very subjective because I wear a mask because I feel comfortable behind it. You know, I don't have to worry who's looking at me. I think it's become a habit more than, it's not just because the government is telling me.
Because you're fearful of COVID?
Yeah,
right?
No. I don't think it's just health now. It's because I feel self-conscious if someone's looking at me now. So that's why I choose to wear a mask.
Wow, that's a whole new different aspect.
Yeah.
Now we need to do a whole new show.
So that's why I just choose to wear a mask because I can, just be here and I don't need to worry who's looking at me, if they can see my whole entire face or not.
Okay,
so yeah.
Let's get some of the men at the back. I see a gentleman wearing a mask.
Hi, good evening. I wear a mask because I feel it's important. And in the starting, the government said that you should wear one, and now they are telling us it's your choice.
Yeah.
But I guess if it's my choice, then I will wear one because I am fearful of COVID. Plus, it's not over yet. And as ma'am said, we have to live with COVID now. So I guess if we are living with COVID, we should be a little bit, skeptical about what's going to happen next. And as this young lady mentioned that this fourth wave might come in, and I guess it might. I also agree with that.
No, so do you feel more vulnerable, or do you feel that if just you are wearing a mask, you're really not making an impact and you're still vulnerable, as opposed to if more of us were wearing a mask? Do you think that maybe the government should have just made us continue with this, or no?
I guess, yeah, the government should have made us continue with this because it's important in my point of opinion. It's really important to wear one. And I see people wearing two double masks. They are double mask as well. So I was one of those people, but now I have moved on to single mask. But yeah, let's see what happens.
Okay. Anyone here who's happy, who doesn't want to wear a mask, who thinks this is good? Go ahead. Let's hear your views.
So I think wearing a mask is very comparable to wearing a seat belt, right? So if given an option, I won't even wear a seat belt. So this isn't something that should be left upon to the people. I think it's still like, I remember of that ad, the elephant ad. So the major part of the elephant is out of the house, but the tail is still inside. So I think the mask still should be mandatory and it should not be optional. So it's like if seat belts were optional, most of us won't even wear seat belts. Yeah. But that does not make not wearing seat belt right.
Correct.
So that's my opinion.
Okay. Anyone in the... Okay, so I have Dr. Sunila Garg joining us. I'm just going to ask you this, your views on this. Tomorrow is Monday. In a few hours from now, a whole new world where we can all walk around maskless. No one is obliged to wear a mask in public spaces. Your views on that? As a doctor, as a health expert, does that concern you?
See, basically what I feel is that primarily though the states have done away with that, and National Disaster Management Act has also, has removed all the restrictions. But, primarily that means we don't have to give, but then the National Disaster Management Act did not talk about, removing the COVID appropriate behaviors. There were the other guidelines which are under the Act. So what I feel as of now, the virus has not gone out of our lives. Number one thing. Number two is that we also have to see about the other infections, like when we talk of multi-drug resistant tuberculosis, that is still there amongst us. We are getting a lot of cases of acute respiratory infections, So primarily, we have to think of that virus has not gone out of our lives. We are still getting about 1,200 to 1,300 cases a day. In our neighborhood, we have got, 15,000 infections in China and also about 5 million cases in UK. We are still getting that. And also in UK, we have found a new variant, which is, combination of B8.1 and B8.2. So which we are yet to see how deadly or how severe it is going to be. But though India has got, protection by vaccination, national immunity.
All right. All right. So we have put together a whole panel of doctors. You've heard all of their views. Now you can choose and decide what you'd like to do with this government advisory about how you no longer need to wear a mask. You will no longer be fined if you're not without a mask. Thank you all for joining us on We the People, where we believe it's important to speak up, but it's also important to listen. Thank you. Until next Sunday. Bye-bye.